Styles and Strategies. And this is webinar number 4 in an 8-part webinar series by the Faculty for Tomorrow Task Force. You can find recordings of all of the STSM Faculty for Tomorrow Task Force webinars at the stsm.org website under Online Courses and Webinars. As far as the Faculty for Tomorrow Task Force is a 2-year initiative to address the shortage of family medicine faculty. It will provide resources and training for new faculty, including those moving from private practice to family medicine education, identify and support young family physicians with leadership potential, ensure that leaders of institutions understand the time and competencies required to be faculty, and expand STFM's formal faculty recruiting efforts for residents. Faculty for Tomorrow is supported by the American Board of Family Medicine Foundation and the STFM Foundation. Without further ado, I'd like to introduce our 2 panelists, Julie Nyquist and Jeffrey Ring. And go ahead and introduce.
Hi, I'm Julie Nyquist. I'm a professor at the University of Southern California, and I've been teaching family medicine physicians for at least 35 years. And I also run a Master's of Academic Medicine program if any of you are ever interested in going to that level of training. And now Jeff.
It sounds like we might be having a little bit of technical difficulty with Jeff being able to...
Good morning. So I'm Jeff Ring. Sorry about that. I am a health psychologist by training and worked for almost 20 years at White Memorial Medical Center, training the physicians in doctor-patient communication and whole person care and a lot of work in culturally responsive care. It is a great delight and pleasure to be sitting here with Julie, my very precious collaborator over many years, and for us to have the chance to explore with you these topics of optimizing learning that are so precious and important.
Wonderful. I'm really excited for the content of this webinar. I think it's such a valuable topic, and I'm excited to keep going with this. Just so everyone knows who's attending, if you have any comments or questions, please use the chat box that's labeled questions on your webinar screen, and you can submit your comments or your questions at any time, and we'll incorporate your participation as we move along through this webinar. So please do jump in and share your thoughts, and we'll incorporate them as we keep going. So without further ado, let's proceed with the webinar.
Okay, so by the end of this seminar or webinar, you should be better able to utilize principles of learning to promote learning, to discuss barriers to learning, and to discuss the growth mindset and fixed mindset as learning styles.
We asked you some questions prior to the webinar and learned some very interesting things. We learned that most of you, of course, are residency faculty. We received 9 stories from you about learning encounters, and we will weave some of those through our presentation today. One, just for an example that you wrote, was that a student had an English as a second language challenge and struggled with everyday tasks and learning. And of course, this can be an additional challenge upon a challenge in terms of how we teach. We asked, how important do you think having a growth mindset is for your learners? And most of you thought that was important. And we asked you finally, how confident are you in your ability to help build an environment that encourages learners to be reflective, use mistakes as stimulus for growth, develop their passion, very important for family medicine, and perseverance. And again, a good majority of you agreed with that. So let me begin by asking you a question. When do you learn best? Under what circumstances, in what environments most enhances your ability to learn? So take a moment, and if you would, in your question box, give us your answer. When do you learn best? We'll take a look at those together. you see the question box? Just type it in. Okay, so I'm seeing already some interesting things. When I'm curious, when I am not rushed, in my own space. I like that. I wonder what that space is. I bet it's cozy and warm. Maybe it's Starbucks. When I have an opportunity to apply the information that I'm learning, applying my new knowledge. That makes sense also, right? It's we think about learning in terms of awareness, attitudes, knowledge, and skills, but so precious and important, especially for that skills learning, to be able to do it, try it, get our hands around it. Someone writes about actively learning happens best for you when you're doing a case scenario. Interesting. The lovely thing about case scenarios is it gives our learners the opportunity to make mistakes in the safety of our classroom and not in the clinic itself. Let's see. When I'm engaged and can work through problems step by step as opposed to just being lectured at. Well, I give you a big kiss on the forehead. I believe that we, as a field, can do a lot of work for improvement on turning down our reliance on PowerPoints and didactic strategies. And we will talk today about adult learning and engagement. Okay. Thank you. Thank you for that sharing. I appreciate it. I'll pass it back to Julie.
Okay, so these are just some answers that when we did a workshop at SPFM, and so they said a lot of the same things you did. They said when it's personal and relevant, when I'm passionate, when thrown into the fire, when there's high stakes, I learn well. When I have context or structure provided, when I read first and get to think, reflect on things, when it's engaging, organized, interactive, when I have repetition, practice, and get feedback. That's particularly important for skills. When it's visual, because I like to take notes. When I must explain it to others, I learn best. And when I'm part of a learning community. So between what you said and this, you get a pretty nice picture of some of the things that are helpful. So now we have a poll for you to take. Which of the following has most often been a barrier to your own learning? So we're going to turn it over to Emily now, and she's going to tell you how to do the poll.
Wonderful. I'm going to start this going here. And so you'll all have the opportunity to vote in this poll and let us know what do you think have been barriers to your own learning. So we're going to let everyone kind of take a moment here, think about it, put your vote in, and then once you've gotten a chance to make your vote, we'll share it with everyone and show you those results. I think that's there's so many barriers to learning, so it's kind of fun to see these votes flowing in from my side, and I'm about to share them with you. I'll give a few more seconds as everyone thinks about it, and then I'll go ahead and share. Wonderful. Thank you, everyone. So here you go. Here's our results. We can see lots of conflicts of commitment where people have too many other things going on. Lack of motivation also got 21%, which is pretty high. Poor time management, yeah, that's a real one there at 12%. And you put in the time, but it's hard to retain that information is 12%. And then many other factors come into play as well. So thank you, everyone, for sharing your thoughts on that.
Excellent. So
I'm just interested that there was so much time conflict or sort of not enough time to learn. My sense of family medicine practitioners and faculty is that you all have a very leisurely life. So actually, I can join into that category as well. What are the barriers? Lack of motivation, we see that in our learners and in ourselves, not having the energy to actually dive in and do what it takes to learn. We do have these conflicts of commitment, many things that pull at us in so many different ways. And we know that especially true of our residents who are taking care of inpatient and outpatient and various clinics, and they have a lot of things that pull their attention away from the work we want them to learn. Time management is certainly an important factor. that I think it's incumbent upon us, maybe as soon as orientation, to begin to deliver this kind of support and training to our residents and students. We have learners who put in the time but don't seem to retain. This is a metacognitive skill. This is about the quality of the time, what they're doing with the learning, how they're actually scaffolding their new learning, connecting it to existing learning, and making use of input and feedback. And there are, of course, many other factors. We have ups and downs in our energy and illness. We have poor instructors. We have poor past learning experiences that impact, the quality of knowledge we have now. And sometimes we just don't have the learning resources available. I'm going to share with you one of the examples that you provided for us about learning. Let me read this to you. And as I do, I think you'll hear some of these themes. A second-year resident was doing an IND of a small abscess in clinic. Even though they went through the procedure ahead of time, we felt that the resident was really struggling with the whole procedure, from anesthesia for the area and then to the actual IND. Ended up that the preceptor had to assist a little more than usual. And afterwards, during the debrief, they went over what went well and what went not so well during the procedure, and some of my suggestions on how to improve. The comment is that it seemed like the resident was receptive to the feedback, and the instructor will be curious about how she does with the next procedure. Such a lovely description. It's lovely because this is a preceptor who is there with the learner shoulder to shoulder. There's a developmental stage that's appreciated that learners are on, and that this is active learning. This is learning with a patient. There's a growth mindset here. I mean, there's the preceptor says, I'm curious how this learner is going to do, invested in what will evolve. And there's some grittiness as well, and we'll talk more about grit, but the resident is trying this new procedure even though there may be some novelty or discomfort, and that they're open to feedback, which is essential, as essential as the supportive environment that this preceptor is offering. So.
So what do we know about learning? So Jeff alluded to a lot of this when he was talking about the example. We know that learning is developmental, learning is better if it's active, and that lots of individual factors matter, and including a growth mindset. We know that growth mindset enhances learning. We know that gritty learners learn better. And we also know that when you use evidence-based learning principles, you can also enhance your students' learning. And finally, a supportive environment really helps. We'll talk about each one of those things. So learning is developmental. The life stage matters. So life stage can bring a lot of conflicts of commitment. You know, if you're in the life stage of being a young parent and you're also trying to be a resident at the same time, that's a great life stage conflict of commitment. So conflicts of commitment can be within the job or outside the job. Stage of professional formation. Now, where are they? Are they brand new? Are they advanced beginners? Remember, novices, advanced beginners, competent. Novices are eager learners. They don't know a lot, but they tend to listen to us, and they smile and nod quite frequently, which we always love. But when they get to be advanced beginners, now, some of you may have heard me before say that advanced beginners like a Swiss cheese that thinks they're cheddar. They're knowledge base, sometimes they're professionalism base are full of holes, but they think they are solid. They know what they know and they think it's enough, and often it's been shown at this stage they do not feel responsible for the consequences of their behavior. So when they make a mistake, they do not feel responsible for that outcome. I actually had a second-year resident who gave my mother a drug that she was allergic to, and my mother died. And the second-year resident actually said to me, but what if she'd actually had a heart attack? You know, I had to give her the drug. So that's an advanced beginner talking. An advanced beginner doesn't feel the consequences of what they did, even if it is a terrible outcome. And so just understand that as you work with them, and also sometimes learners really can't accept that they made an error that caused harm. And that's a whole nother issue that goes beyond learning stage. So learning stage, stages in professional formation, metacognitive knowledge. I have another slide for that. So diagnose your learners, see what stage they're in. Adjust your instruction to their level, instruct the novice, coach the advanced beginner. They need lots of coaching. They're dangerous because their confidence often outstrips their competence. And facilitate for the competent. They need you now. They come to you when they need you. You just have to meet their needs. And build a learning community wherever possible. Keep your learners working together. Help your senior learners engage with your junior learners in a positive way. Don't tolerate backbiting and don't backbite. So metacognitive skills. So sometimes you'll have a learner in difficulty. We could run a poll on that and ask how many of you have had a learner in difficulty, but then you would all say yes. And so I'll assume you've all said yes. And this is something that can be helpful to you in thinking about those learners. So all of your learners by graduation should all be able to assess the task at hand, no matter what that is, evaluate their own strengths and weaknesses in regard to that task, plan an appropriate approach to accomplish the task, apply strategies, and monitor their own performance, and then reflect on their performance in action and on action later, and adjust their approach. So sometimes you could use this list to break it down to see where are they falling. Where is their problem taking place when they're trying to do a task? So hopefully this will help you. I want to pause at this point to see if there are questions coming in, Jeff.
I'll check that questions in just a moment. I thought this was a good point to share a case that one of you submitted. You said that I had a first-year resident that struggled with practical management of a patient with run-of-the-mill heart failure exacerbation. The learner struggled with putting together all of the factors involved in management. It took a long time, but repeated review and persistence and real-world experience and maintenance by the resident really helped. It's a beautiful example. Again, this is about the learner's organization of knowledge. It's about the importance of repetition for learning. It's the importance for that beautiful iterative cycle of practice and feedback and practice anew and feedback again and practice anew. So, all right, let me just look and see if there are any questions. I'm not seeing any right now. So.
Okay. Then I'll move on. So learning is better if active. Learning should be participatory. I'm thinking classroom learning. Participatory, collaborative, constructed. And Jeff was just talking about the importance of practice with feedback. Practice, if you practice without feedback, you can practice the wrong way 52 times and you're still just as bad as you were when you started. That's why you need to have feedback and iterative learning changes. So mix up the classroom activities. No lecture should go longer than 15 minutes without engaging your learners in some active way. Build a learning community where possible. I've said that before. I'll probably say it again one more time. And learning shadowers, now that's taking you clinically. Shadowers need specific tasks. If you're going to have young people following you around, give them specific tasks to do while they're following you. So learning should be participatory, collaborative, constructed. That means when you can, learners should build their own skills. You see the picture in the bottom corner there are some of my learners at our team workshop. They built a marshmallow tower. Now you might also notice in their beautiful picture of their tower, someone's holding it up. The marshmallow tower didn't stand long enough to make it to picture time, and so so you see the whole 5 residency physicians from multiple different specialties there enjoying their active learning experience. They are building a learning community with one another. So yes.
Julie, there are 2 questions that maybe you can take. The first is, what do you mean by diagnose your learner? And this isn't really a psychiatric or medical diagnosis. It's say more about that. And then secondly, can you give some examples of what it means and when to shadow learners?
All right, so let's go back a slide or 2. So diagnose your learners is just to see where you learn. Oh, so I'll be talking in a second about prior knowledge. So what you want to do is see what prior experiences have the learners had. And I think I'll take one step back further, sorry. So when a new learner comes to you, and this is your first time with them. The most important time you have with them is the first 5 minutes. And in that first 5 minutes, what you're going to do is find out who that learner is, what their basic interests are. So we're now thinking about medical students, for example, someone rotating with you from another specialty that's rotating with you in family medicine for a month in your clinic or on the wards with you, because sometimes teams have multiple learners, but I was thinking of medical students in particular. So you want to see, is this, for what you teach, have they ever done it before? Is this something they're interested in doing? Something they care about? Because I'm thinking motivation here. What's their confidence? What's their prior knowledge? So you want to get to know them and what's important to them, and you want to see what stage they are. So in the developmental sense, you want to know if they're a novice, an advanced beginner, or competent. And so you question them a little bit. You'll also watch them to see, but at this point you're getting to know them too, and you're helping them become part of your. And then when we shadowers, someone that's following behind you. Sometimes you have medical students, sometimes you're in a situation where you can't always let the medical student put your hands on your patient, like they're following you with your private patients, and this patient hasn't given them permission to actually examine you, but they've given permission for them to be with you. And so in that situation, that's when you need to give them. So I'm talking with Mrs. Smith, and she's had diabetes for 15 years, and I want you to particularly listen to how she handles her diet and exercise. And so that's what they'll be listening for when you're talking to that, and then afterwards you would ask them about that so that they're focused and engaged and don't feel left out. You know, sometimes if they're just with you, they don't know what to look for, they don't know what to see, and so they think it's a waste of time. So you're making it a valuable learning experience by engaging them and making it more participatory. Hope that answers your question. So moving on to individual factors affect learning. So we'll talk about a few of these. We won't be able to talk about everything, but we'll talk about mindset and grit, about prior knowledge and experience, how prior knowledge and experience can help or can hinder, and how learners structure knowledge also matters. Sometimes their knowledge structures are not advanced enough. We'll talk about motivation. We won't really get a chance to talk about life circumstances and wellness, but we'll periodic and supporting factor or so learning styles and mindset. Oh, so you have it here. Emily, we're going to do a little poll again, right? So let's read these first. Let's take a look, and then she'll put the poll up. So make sure you've read all 4 of these. Don't worry about the hint. I'll get to that later. And then she's going to put a poll up, and you're going to pick one of them.
All right,
so
that's right. Just a little bit of a chance, and then we're going to go ahead and launch the poll. And you guys can go ahead and start voting for how you view intelligence and learning, and what your options are there. We had to shorten the answers somewhat for this particular poll format, but I think you can still get the idea here. And lots of votes are pouring in. We've got a few polling ahead here, so I'm eagerly anticipating seeing where we land on this, because even as we were preparing for this webinar, we had a kind of a fun conversation here with our panelists and myself about how different ways that you could view this. I think it's something that we have maybe intuitive opinions on, but we're about to find out a little more details about that. So thank you everyone for voting. I think we've got a lot of votes in, so I'm going to go ahead and share the results with everyone. And here they are.
Okay. So what we see here is, so if you found yourself, your head nodding as you read the first 2, you might tend to have more of a fixed perspective. And if you found your head nodding and you found yourself marking one of the last 2, then you probably have more of a growth perspective. But just so you know, many things in our lives, well, my story is when I was telling my brother when I was in Michigan in October about growth mindset and fixed mindset, and so later he told me he was watching me all day long, and then finally he yelled, he pointed his finger at me and he yelled, "There's Julie, fixed mindset, fixed mindset." So we all have elements in our life where we have fixed mindset and areas where we are better with our growth mindset. And so it isn't an all or nothing phenomenon, but we tend to lean one way or the other. And we know that when you can have a fixed mindset as long as everything is rosy in your life, as long as everything in your learning is going perfectly, as long as you're feeling like you're always successful. But with a fixed mindset, there always comes a time when you hit a wall, when this thing is not easy for me. And do I give it up? Do I continue it? And fixed mindset says, oh, this is too hard, I shouldn't do it. Growth mindset says, this is hard, I am going to master this. Nothing will get in my way of doing this. My granddaughter had a growth mindset. My other granddaughter brought this puzzle she created, and she wanted everyone to do it. It was she's in 9th grade, it was a test. And so my other granddaughter was not going to give up. She did it for 50 minutes. She was never going to stop until she solved it. My son, who's a high school science teacher, did it for a few minutes, and there were so many people around, he felt distracted. He said, I'm not going to do this anymore. This isn't worth it. And so he was exhibiting a fixed mindset, and she was exhibiting a growth mindset. So to encourage a growth mindset in your learners, provide not yet feedback. So it looks like you're struggling with a skill. You've not yet mastered it. We're going to need to work on that. With a lot of hard work and effort, you'll get it. It might take you longer, but you're going to get there.
I just want to add to that. I've been doing some projects where I've actually been sitting with preceptors, watching how they teach and giving them feedback on the conversations they hold with their learners. And one of the things that I've seen is kind of a reluctance to actually use the vocabulary of milestones. I think that I really like milestones. They behaviorally make clear where someone is and where someone should be going. And so I want to invite you to use that kind of milestone conversational structure more, to be able to say, this is what I saw today in your work with a patient, behaviorally and specific, and this is where I would like to see you as you develop specifically and behaviorally. So the milestone conversation, the evolution conversation, woven with very specific details of why you are at this point still in evolution and not done with your training. I think that's important. And for some reason, I think we as instructors are often shy or slow to provide that exquisite detail and clarity and directness of feedback. Our learners deserve that. ACGME counts on us to do that work. We are empowered and counted on to provide that feedback, and our learners deserve it. They stay up all night, they work hard, they sacrifice a lot, and the sacred agreement is, for all of that patient care and learning that you do, I will give you the full story, honestly, fairly, truthfully, and behaviorally, and I will journey with you as you move forward to become the doctor, the healer that you are destined to become.
So when this is most important is when you have a learner in difficulty. We don't worry about your mindset as long as things are going great, but I'm sure all of you, I certainly, in my 35 years of teaching, have met learners that when you give them feedback, they don't seem to hear it. They certainly don't use it. And that's indicating a fixed mindset. So I wanted to tell you, so what Jeff said is totally true, that not yet feedback with specific ideas for stretching helps build the growth mindset. And I know, did you see in the corner down there where I said Carol Dweck has a 10.5-minute TED Talk on mindset that will really help you understand it very well. So moving on to grit. Grit is fabulous. I totally loved Angela Duckworth's book, Grit. It really made me feel so encouraged in terms of the difference that I can make with my learners. I was really felt that she gave us a great gift. Grit is passion plus perseverance. And there's a little tool online, and it's in her book too, that you can take to see how gritty you are. And of course, our grit depends on, so she was thinking, so in the workplace, are you passionate for what you're doing? Do you persevere beyond troubles? So effort ends up counting twice. You have talent times effort equals skill, and and skill times effort equals achievement. It's practice that builds experts, not talent alone. practice builds experts, not talent alone. So, and surgeons, I've talked to surgeons too, it's wonderful if you have great hand skills, but you can still become an expert even but you need more practice to get to that same expertise level. But we know that the musicians that end up in concert in like Disney Hall here in Los Angeles were the ones that worked hardest. They weren't the ones necessarily that started out with the most talent.
As a father of two teenagers who are learning to drive, I've been very demoralized about practice building experts, but thank you, Julie. You've re-inspired with some hope today. Inspired, thanks.
So yeah, the hint here is for you all to model grit, to show your passion for what you do, to encourage your learners' interests. And that goes back to diagnosing your learner. What are your learners' interests? If I ask you what your learner's interested in and you say, I don't have a clue, then you probably haven't done your due diligence in diagnosing your learner, because you need to build on those interests and help them practice to ultimately build passion. And, you know, demonstrate also that hard work can be joyful. Avoid complaining about your workload and what you have to do. That makes them think that work is bad. You want them to think that hard work is good. So bite your tongue before you start complaining in front of your learners about your sad fate as a faculty member. and she'll talk only 6 minutes. Very useful. Are any questions coming in, Jeff? None yet. Okay, fabulous. So now we're moving into some of the things. You know, Jeff and I have absolutely loved Susan Ambrose's book on learning. We've been teaching this since it came out in 2011, and this is principle 1. Prior knowledge can help or hinder. It helps when it's activated, sufficient, appropriate, and accurate. So if you're taking a learner to see a patient, do they know about the problems that this patient has? Do they know enough? Is what they know appropriate? And is it accurate? Sometimes people bring prejudices and biases to the table that can be hard to overcome. They have inaccurate information. So again, diagnose your learners' prior knowledge here. Here when I say diagnose your learners, know what they know about what they're doing. It takes 30 seconds because the deer in the headlights tells you everything. And then you just say, okay, well, we're going to need to read, you'll want to read more about this, but let me tell you 3 important things before we go in to see this patient. Set expectations with your learners using closed-loop communication. Just like with your children, or in my case, grandchildren, well, no, it's even worse with my children. I told my son came in last night to help out because I'm giving a Christmas party this weekend, and I'd set the icicles to put on the tree right next to that tree, but when I said do the front tree, I didn't ask him which tree he was going to go to, and he put the icicles on the wrong tree. Fortunately, my husband came in 5 minutes later, and they put the icicles on the correct tree then. So I didn't close loop my communication because I was in the middle of teaching, and so I got not what I wanted, but something else entirely. Closed loop communication. Make sure they understood and are going to do exactly what you plan to. If we did a poll right now and I said, if any of you have had a learner do something you didn't want them to do, I think most of you would probably say yes. Yeah, or a child. Yes, indeed. Oh, and of course my child has children that are almost teenagers now. So connect new knowledge to old to reinforce connections. Organization of knowledge. How learners organize knowledge influences how they learn and how they apply what they know. Novices have sparse, superficial knowledge structures. You know, they have isolated facts. You see the little polka dots down there, little colored polka dots? That's a novice. They know stuff, but they don't have connections between them yet. So, and they may pull the wrong one out of their role. You're asking for something that's aqua, and they pull out an orange one. You know, so it just doesn't even fit what you're talking about because they didn't know how to pull it out or connect it. And so thank them for their thought and connect their thought to what you wanted.
And I want to invite you to think about your role in helping learners to build those networks of knowledge. How do you start a didactic presentation? Do you connect it to a previous didactic presentation? As patients are being seen, do you articulate how that learning, that new learning, is connected to the larger learning happening over the course of residency or medical school? I think it's really incumbent upon us. Learners don't really know so well how enriched their network of knowledge is. This is for us to see, to watch, to nurture, to invest in, and to constantly speak in a way that we're hooking one new piece of learning to another.
And, in thinking about learning styles, this is one place where you can use all of them. In the old, we used to think of learning styles as like visual or auditory or kinesthetic or reading, writing. Well, in organization of knowledge, you can encourage people to organize their knowledge all 4 ways. If visual helps them, mind maps are great. Or they can make outlines, or they can organize things physically, like put it on a board, put it on Post-it notes, and put their mind map up on a board if they want to touch it and feel it. So you can encourage all of these different ways to help them increase their organization. So this year I asked my students, people just like you, when they were designing a piece of curriculum in a course I teach on curricular design, to make a mind map, which is just earlier I showed you an example of a mind map. Actually, right there, that's a little mind map right here with learning on environment. Whoops, where did I go? I'm going the wrong way. All right. Somehow I guess it doesn't go backwards. Yeah, it does backwards. Sorry. I was trying to go backwards and I went forwards. Oh, there. Learning. Individual factors. That's a mind map. And that's something I had them do. I had them take the entire content of their curriculum and put it in a mind map, which helped many of them a lot in better understanding their content. So it's a tool you can use for organization of knowledge too. Questions? No? Okay, motivation. Motivation matters. And there are 4 questions that you can use with your learners. This is something Richard Clark, so what's their issue? If they don't seem motivated, is it a problem of if they were answering these questions, how highly do I value the goal? Can I do it? Do I feel like doing it? Well, I'm permitted to do it. So how highly do I value the goal? Is it important to me? Is it relevant? Can I do it? Do I have the confidence to tackle it? Do I feel like doing it is mood? And are there other contravening factors that keep me from wanting to do this? And will I be permitted to do it? Really is about the environment. Will this environment let me do it? When you attend a webinar like this, will your environment allow you to do some of the things that you learned today? So to encourage motivation, connect activities to the learner's interests, provide challenges at the correct level, encourage commitment, necessary effort, and growth mindset.
Julie, just really quickly, Cynthia asked a question about just expanding on the difference between the novice and the advanced expert, if you could articulate that.
The advanced beginner.
That's it.
Okay, so
Hello, everyone. We seem to be having a little bit of a momentary glitch as Julie gets she's back up.
Sorry.
Wonderful.
Yes, you were hearing me through Jeff's mic instead of my own, sorry. Because we're in the same room, we have to mute every time the other one speaks, and I forgot to unmute. Sorry. So what I started to say is the difference between the novice and the advanced beginner. A novice comes in, the novice has limited knowledge and limited experience in that setting. And so they tend to be eager, they tend to listen, they tend to do what they're asked. As they start maybe you've heard of sophomore syndrome or little knowledge is a dangerous thing. That's the advanced beginner. They're feeling a little haughty. It happens about 6 months in. They're a little bored. Why do I have to do this again? Oh my goodness, I've done this so many times, but it's not really true. One of my students last night was talking about one of her residents who halfway through the rotation seemed to be getting just bored, didn't seem to be putting energy in, and he said, well, I'm seeing the same kind of patients over and over again. This is a first-year resident of emergency medicine, and so she took him aside and started talking about, well, how can you put more value into seeing the same patient? Are they really the same patient? Is just because it's chest pain, does that mean it's exactly the same? You can use that opportunity to think about all of the different causes of chest pain. You can deepen your knowledge with each new patient. So that's the advanced beginner. They stop seeing the value in it. They're not pushing themselves or being pushed to see more. So the advanced beginner now, they think they know it all. When I hear an advanced beginner, when I hear talk like, well, not only can my preceptor not teach, I don't even think they know anything about their specialty. I've actually heard those words. That's an advanced beginner. They think they know more than you do. If you've ever raised teenagers, you know what advanced beginners feel like. We have 5 children and 5 grandchildren, so I've been through many advanced beginner experiences. I love advanced beginners, but you have to coach them. That is, they need close coaching because you have to keep them, they lose motivation really easily. You have to help them. They have a, do I feel like doing it? They don't feel like doing it. I don't feel like doing it.
Kay asks, how do you really help that advanced beginner get past the idea that they know everything?
Well, sometimes you can actually push them a little bit. This is where asking challenging questions, like what if questions. So what if this patient that you've seen a lot of, what if they're only 2 years old and they have these same symptoms? What would you be thinking about then? And all of a sudden you've changed the parameters, and now maybe they say, oh, I don't know what to think. What about if they were 2 days old? Oh my gosh, I don't know anything about neonates. All right, so now you're starting to be realistic. Well, let's think about it. Let's think about what's different between someone who's 62 and someone who's 15 and someone who's 2 years old and someone who's 2 months with these kinds of symptoms. So, and then you can challenge them to do those sorts of things on their own. That is, you show them a gap. Now, as they learn more, they start to see the gaps, by the way. And they become, when they're just a baby Swiss, that is, they still have a lot of holes, but the holes are smaller, then they see them all. And all of a sudden, they're terrified. So as they're approaching confidence, sometimes they actually lose confidence. One more? No.
No, I want to build upon that as we talk for a moment now about supportive environment. I think that helping them see gaps is part of it, but also reassuring our learners that we are there with them, shoulder to shoulder, in the learning journey is very, very important. I think we can say that the parallel between exquisite relationship-based care between doctors and patients should, as best as possible, be parallel embraced as the relationship-based educational process between preceptor, teacher, and learner. I'm going to read you this one lovely example that one of you sent in of a case. Intern time management with seeing patients on inpatient service was the challenge. They were finishing their notes prior to going to clinic. What helped was frequent follow-up with suggestions on improvement, but not making it a shameful thing. This is so beautiful. I mean, this gives me, this is beautiful, right? This is an educator who understands how tender the soul is of the learner, how vulnerable they are and we were and continue to be, how much is the weight that our learners carry upon their shoulders of patient care and the fear of making a mistake or the reality of the sort of the knowledge and skills treasury that they need to embrace. So supportive environment matters. Relationship matters, whether it's in the classroom or in clinical or the sort of how your programs culture, it carries out learning, and we need a whole other webinar and another day to talk about the very bleak history in medical education of harassment and humiliation-based learning, which does nothing for that poor little hippocampus to be able to absorb new information. If it's next to an amygdala that is overstimulated in fear and terror, hippocampus is just going to freeze. So let us just remind you what you know. Develop a welcoming classroom and clinical environment. How do you start clinic when you're precepting? How do you begin rounds? What's your welcoming hook to begin a didactic presentation at lunchtime? How do you invite learners into the learning experience? We need to hold ourselves and all colleagues responsible for that negative and abusive language or action in learning settings. I'm hearing more and more about medical schools that are hiring the czar of bullying, anti-bullying, right? Someone who really sort of is charged with keeping a good eye on the culture of learning and the hidden curricula. Finally, we always want to set clear expectations for learner treatment of each other. This is not just how we treat our learners, but how third years and second years and first years and medical assistants and nurses and all the ways that we as a team, a community, a family work together in healthcare delivery. Healthcare is a team sport, and we will only be successful to the degree that we are embracing that team spirit. Let's see, so there's a couple comments here we'll look at really quickly, and then we'll do a commitment to act. Let's see, I'm a newer faculty member. I've often struggled with the advanced beginner. I think my bigger struggle is that they make me doubt myself. How do I overcome that?
Well, you're an advanced beginner teacher, or maybe still sort of a novice teacher, so really you're helping yourself right now by learning more about teaching, by learning more about learning principles, by learning more about how your learner is and how they behave, and understanding that it's, for most learners, a temporary state that they're in. You just have to smile when they challenge you, and if you don't know, just admit it. That's one way to get over it, is to say, I don't know, we'll have to look that one up, or I'm not sure about that. It's fine to do that. That becomes a way you can handle that. Is there another one?
Just an editorial comment, stop running boot camps. And I agree and appreciate that. Boot camp as a word does not really speak to a desirable learning experience. So finally, what I would like to invite you to do for a moment, I mean, let me just say, education is great if it's about awareness and attitudes and knowledge. But in the end, when it comes to forming physicians and teachers, it's really all about the skills. And so I would want to invite you to take a moment and reflect on what do you plan to do? Skills, different behavior in your teaching, different or enhanced based on the work we've done here together today in this webinar. And if you would add that to the question box, we will take a quick look at those. What do you intend to do new, enhanced, differently in your teaching based on what we've done here together today? All right, focus on creating a welcoming learning environment. Thank you. I love that at every level of learning. Asking learners if they would assess themselves as having a fixed or growth mindset. Tina, beautiful. Engaging them in their own self-reflection on how they learn. I will try to take a few minutes with my new learners to diagnose them. I'll also strive to encourage my students with more specific feedback. Beautiful. Feedback, specific, detailed, is a gift from the heavens. I will try to find the learner's interest. Thank you. That's a learner-centered educational approach, and I give you a kiss on the forehead for that. Recognize the advanced beginner and adjust my teaching during the clinic session. That is also a great gift to them. If we are expecting advanced skills from a novice, it's cruel and unusual for all. Finally, stop complaining about my workload in front of the learners, or at least try to minimize it. Thank you. I appreciate that. We do want to attract people to family medicine. So we can pick and choose what it is. I'll just read one or two more of these, and then we'll open it up for any final comments or questions. Having more understanding for the advanced beginner, not getting defensive, but maintaining our presence. That's so beautiful. That's connected, Lou, to mindfulness, to showing up, to being strong and healthy ourselves, to coming with that love of teaching and healthcare that first brought us into this field in the first place. And then finally, I'm thinking there's not much new here, but continue to create a positive learning environment. That's the substrate. That is right. We are here to remind you what you know, and which you may have forgotten because you are so full and pulled of distractions and tough learners and ACGME requirements. But remember what you know, remember what you love, remember the tender student that lives within you still, and bring that warmth to the teaching. So, we've listed some references here for you, and I think those slides, I'm pretty sure, will be available to you. Any final questions that we can answer? So Tina says, I noticed the session's being recorded. Can you all get it? Emily, do you want to answer that question?
Absolutely, yes. So we have recorded this session, and we will be uploading it, I believe, well, it is today. We'll be uploading it to the STFM website. If you go to our online courses on our website and then look for webinars, all of our sessions for the Faculty for Tomorrow webinar series are being recorded, and please do share them. They're actually uploaded right on YouTube, so they're easy to share that link with whoever you like, so please do that.
Thank you, Emily. Anything else in the last moment or two? I mean, someone was commenting that we had a lot of fun in the session. It was certainly a lot of fun for us. I mean, it's fun for me always to work with Julie. It's fun to talk about these issues and to put our warm hands of support on your very hard work. It was really fun to read the cases that you sent and see what you're struggling with and what you're achieving as educators. And, you know, we do this work all together, shoulder to shoulder. This is the investment in the next generation of healers for our very vulnerable and tender communities. This is, you know, what healthcare is all about. So.
And we want to help you become gritty, to help you enhance your passion, and to encourage you to persevere even when there are difficulties or bumps in the road, because you are enough. We believe in you.
With that, we'll turn it back to Emily, and thank you all very much.
Wonderful. So, wow, I've so enjoyed this webinar. I just wanted to kind of let you all know we will be sending a post-webinar survey out to get further feedback from you all. We're always eager to see how these webinars influenced you, and we do appreciate you taking just a few moments to fill out the survey and let us know what you learned and what you liked about the webinar. So it's fantastic. And I also want to just remind you that STFM is here to help you with all of your questions that you have. They're so valuable about learning, and we do have a lot of resources on our website as well. We have fellowships to help you enhance your ability to provide learning, and we have our resource library. The STFM resource library has many PowerPoints and handouts that you can use as you enhance helping your learners to learn better. So I just encourage you to take advantage of those, and I just want to really thank Jeff and Julie. This has just been a fantastic webinar. I've been thrilled to get all of these tips on learning. I think it's so relevant to our entire membership. So thanks again. And without further ado,
You're very welcome.
Thank you. I just appreciate it, and I see a few questions come in that are not questions. They say clapping, and thanks so much. So I think our audience had a lot of fun as well. I'm glad it wasn't just me who was highly entertained in this webinar. So I appreciate your work to both of our panelists. So thank you, and have a wonderful rest of your day.